Thursday, 8th of January 2015, live from ITV Studios in London. This is Good Morning Britain.
Now then, we've heard of rehab centres for drug and alcohol addictions, of course, but a small number of clinics in America are now treating people for addiction to sugar.
Dr. Hillary took 3 Good Morning Britain viewers to meet the doctor behind that treatment programme, who says sugar is as addictive as Class A drugs.
Many of us regularly crave a sugar fix, but when does an innocent habit become a life-controlling addiction? Here at the Malibu Vista Recovery Centre in Los Angeles, patients are being treated for addictions to food in a residential treatment program created by physician and nutrition expert Dr. Pam Peeke.
Now, the concept of food being addictive is relatively new, and right at the top of the tree there is sugar.
The reward center in our brain just loves sugar. Neuroscientists, backed by the National Institutes of Health, have found that refined sugar most definitely affects the reward center precisely the same way that a drug or alcohol does.
We brought our 3 GMB viewers along. All have a sweet tooth, but are they addicted?
Ladies, at the start of all this, we asked you to fill in a food addiction rating scale in a questionnaire. Dr. Peeke, what were the results?
You all have elements of food addiction.
If I open a bag of sweets, I wouldn't put some back in the fridge or anything. It has to go.
Shame, blame, and guilt is very common. Do you feel that?
I don't until I look in the mirror.
What happens when you look in the mirror?
I don't like what I see.
So what are the root causes of food addiction?
Smoking got replaced with eating just in general.
What we're hearing here is cross-addiction. You started with one, which is nicotine, and then you flipped it over to sugar. Do you feel stressed?
I feel tired and stressed all the time.
Stressed, spelled backwards, is desserts.
Dr. Hillary is here with one of our sugar-free GMB volunteers, Carla. Very good morning to you. How are you feeling?
Fantastic. Absolutely brilliant.
But pretty shocking, Dr. Hillary, to hear, that sugar is quite so addictive. Is that something that you stand by?
Yeah, I mean, I think people would say, come on, sugar can't be addictive as such, not like a drug like cocaine or ecstasy, but actually the same pleasure pathways are triggered by that sugar fix. So people who crave sugar should ask themselves these questions. Is there a tolerance involved with taking lots of sugar? In other words, do you need more to get the same effect? Answer this question. Can you eat one chocolate biscuit or do you finish the whole packet? You get tolerant. That's part of addiction. Do you get withdrawal symptoms? Do you feel depressed and anxious when you go on a diet because you're missing what you crave? Yes, you do. That's part of addiction. Do you feel cravings and intense cravings that make you go and seek the food out? Yes, you do. Do you feel that you ought to cut down, knowing that it's bad for you? Yes, you do. But you carry on despite the negative consequences. All these things are the same kind of features of any addiction, whether it's alcohol, cocaine, hard drugs, opiates. There are basic elements of addiction that are there, and it's very difficult to quit the habit. It might not be as strong an addiction as to opiates, but it affects many, many more millions of people.
I'd imagine, Carla, that all of those elements and all of those factors that Hillary's just mentioned apply to you.
I would eat a whole packet of biscuits, and I would be planning for the next lot as well.
And you knew that you needed to lose the weight, but you couldn't stop?
Yeah. I was worried about how I would feel. I'd heard about headaches and all this from going sugar-free, but it hasn't happened because I'm getting the right nutrients.
That's really serving to replace the bits that you're missing.
Yes.
Now, look, when we started this, we asked people to send in entry forms to be part of the Good Morning Britain sugar-free diet, and you sent us a very moving letter, which would you mind reading out some of that letter to explain a little bit to some of our viewers just how important this was to you?
Yeah, okay. I sort of set the context that it was my 40th birthday, so 2016, and I was sort of looking back, so it was only I knew the discomfort I would wake up in because of pins and needles in my arms where I'd laid on them for too long. I knew how ashamed I was at being like that and secretly hated myself for putting myself in that position in the first place. But I was tired and I was in so deep that I couldn't help myself. I felt alone on many levels. because I'd been doing the diets or trying to, and they just weren't working. I was buckling under the going for a sugar fix, or because I obviously wasn't getting the right nutrients.
Yeah. Well, we really appreciate you sharing that. It's obviously an emotional journey for you, and I know that we're going to be catching up with all three of you tomorrow, see how you're doing after the kind of first week or 10 days of this. Thanks so much, Carlo, and Dr. Hilary, thank you very much indeed as well.
Keep it up.
Thank you.
Whatever happens.
Yeah, we're all with you.
We are,
I fell off the
absolutely.
wagon yesterday, but I'm back on it. You told me to
and you've got your
Yeah,
water
the fruit's
and fruit
there, the
again,
water's
right?
there.
Yeah.
Replace the pastries, isn't it?
Yeah, although she went home and had how many rusks?
I know. Anyway, let's
Rusks.
not talk about that.
Back away from the baby food, I said.